This video features 4 brief clips from a Senate hearing on September the 9th, 2025, during which questions arose about CNN's vaccine expert. The CNN article highlights the doctor's claimed proof that there were 661 placebo-controlled studies for the childhood vaccine schedule, which has been reviewed before by the healthcare watchdog. See link above. He was subsequently invited to a Senate hearing where he was confronted by other witnesses. The CNN expert then acknowledged he had not reviewed his collection of 661 articles when other witnesses had and found no such proof. The CNN expert's X account was subsequently deleted. Dr. Jake Scott informed the Senate of 661 placebo-controlled trials on vaccine safety. However, Aaron Siri and Toby Rogers noted that none used a true, inert placebo for CDC vaccines. Dr. Scott admitted he hadn't reviewed the studies, highlighted by Senator Johnson. Dr. Jake Scott, a key figure in the Senate hearing, claimed all 661 studies were relevant to the childhood vaccination schedule, and all used inert placebos.
Our findings directly refute false claims about vaccine testing. We documented 661 trials using inert placebo controls with saline, sterile water, or other biologically inactive substances. The claim that childhood vaccines haven't been tested against placebos is demonstrably false.
Toby Rogers, PhD from the Brownstone Institute, challenged the validity of the trials cited, emphasizing that the CNN expert acknowledged bias and ethical problems limiting the use of placebo trials, yet claimed he found hundreds.
So if you go through all 1,704 trials in the database that Dr. Scott has put together, as Aaron Siri has done, you'll find that the inert ingredients are not inert. The placebo is not saline, and the randomized control trial does not have a completely unvaccinated control group. And we know that my assertion here is correct because on page 9 of his written statement, Dr. Scott states that vaccinated versus unvaccinated studies are especially prone to bias. Right, to Dr. Scott, a proper vaccinated versus unvaccinated study is unethical.
Aaron Siri, a vaccine injury attorney, meticulously reviewed the CNN experts database.
You actually drilled down into those 661 trials. Let me give you the breakdown of them, okay? 567 of these trials were not a routine injected vaccine for a disease on the CDC's childhood schedule. They were for HIV vaccines or other vaccines. So totally irrelevant to the safety of routine injected childhood vaccines. The remaining 94 studies, 70 of them did not involve healthy children. For example, trials of HIV-positive adults. Again, completely irrelevant to the safety of childhood vaccines. Of the remaining 24, 21 did not involve a U.S. licensed vaccine it was not a vaccine used as a control to license a currently used U.S. licensed vaccine, for example, a Chinese flu shot, stuff like that. That leaves us with 3 studies, 3, that were claimed to have an inert control that were relied upon to license a routine injected childhood vaccine out of this entire list of 661. Okay, let me walk through those 3. One was a trial for the chickenpox vaccine, the varicella vaccine. Now that trial had it was only a few hundred people, so it was underpowered anyway. But Dr. Scott says it's got an inert control, but actually it was an injection of neomycin, an antibiotic. That's not inert. No. The second one was Gardasil 4 trial, which had thousands and thousands of girls and women in the control group. Almost all of them got an aluminum adjuvant injection. And then there were a few hundred, only a few hundred, that were labeled as a inert control, but they weren't. They got everything that's in the vial except for the antigens in the alum, which included L-histidine, polysorbate 80, sodium borate, yeast protein, not inert. And then the third one was a Gardasil 9 trial, which finally, by the way, did have a saline injection, just a few hundred. There were thousands and thousands of girls, women in that trial. They all got an injection of lumimagined, which I don't even know if it's ethical to inject somebody with something that's neuro and cytotoxic, but leaving that aside, the few hundred that got the placebo, but they only got it if they first got 3 doses of Gardasil 4. So again, not an actual inert control group. The result is there's 0 trials, 0, which were relied upon in this list of 6061 to license a routine injected vaccine on the CDC schedule that included a placebo.
Dr. Scott then acknowledged he had not reviewed the studies he referenced. This admission was a focal point, raising concerns about the reliability of the presented data.
First, Dr. Scott, respond to that.
Yeah, I'd be very surprised if you went through all 661 trials. We haven't even conducted the full analysis yet.
Again, I personally think that Mr. Siri did a pretty good job of taking that 661 studies apart.
Dr. Scott's social media account, which promoted his project on vaccine safety, has been deleted. This development followed his Senate testimony, where he admitted to not reviewing the studies he cited. We research, you decide.